Hi, my name is Courtney Johnson, citizen and resident of Prince George's County for now 25 years. Okay. As I said, 25 years citizen and resident of Prince George's County. Multiple care from the Prince George's County Hospital in PG County, major accident and other surgery I've received myself, so kudos, great job. My wife is presently an employee of the Prince George's County system, and we have no problem for 18 years. Like my party said, on game day, I'm very concerned about game day. Emergency traffic can get through with their lights on all 4 locations. I'm now working with one utility company for 23 years right here in PG County, and I can tell you, if you don't have a flashing light, you suffers.
Good evening. My name is Reginald Reddy. I'm a resident of the Largo Town Center condominium. It's located right across the street from the Largo Metro Station, and I am a true TOD guy. I commute by the Metro subway system. I would like for the new medical center, if you guys so choose, to have it at the Largo Town Center Metro Station. Please consider these factors in your decision. There are currently 2 senior housing complexes that I know of that are within the Largo Town Center radius. The Lake Largo Senior Apartment Community and the newly built Jericho Apartment Residences, which is located right up the street. They could be served very well with the medical center right at a Metro Station. Second factor to please consider is the opportunity to collaborate or reach out to Kaiser Permanente that currently exists on the corner of Landover Road and Technology Way. Please consider with hospitals in Washington, D.C. You got Howard University Hospital at the Howard University Metro step. You got George Washington University Hospital at the Foggy Bottom Metro. And just in my recent travel on the subway, they're building a new medical complex at the Minnesota Avenue Metro Station on the Orange Line, which is right next to the RFK Stadium. And also, please consider this a hospital at the Largo Station will give you an opportunity to fill vacant office spaces that exist in office parks surrounding the Largo Metro Station, such as Inglewood and the Lots for Business Park region. Thank you.
Good evening. My name is Leslie McCray. I'm also a resident at Largo Town Center. I'm the vice president of my homeowners association and was past president for 8 years. Thank you, Derek Davis. We voted for you. Okay, I'm going to make this short. Reginald basically gave you an outline of the consensus of what we were thinking, that Largo would be the better choice for a hospital center, in that there's safe walking, for pedestrians to walk. You won't have to do any further too much infrastructure, which would save on costs that could be diverted for off-site funds, like the use of Kaiser, collaboration with existing medical, small medical centers. Health care of made more affordable to people who work but simply can't afford to buy health care for their workers, a small business owner. And Largo would be the better choice. We won't have to worry about them bulldozing anything in the future there. Thank you.
Good evening. My name is Teresa Dudley, and I live in the best councilmatic district in Prince George's County. I live in District 5. Thank you, Andrea Harrison. And I want to make sure, that's right, I'll collect a check from you on the way out the door. No, I'm just kidding. I'm just kidding. Look, the reality is Landover Mall is an eyesore. You can't hear me as loud as I am?
Speak into the mic.
Oh. I never had anybody tell me to speak louder, but I'll go for it. Okay. My concern is that Landover Mall is an eyesore. And the reality is that if you live in Prince George's County, to get to Largo Town Center, if you live in Greenbelt or if you live in Oxon Hill, it's still going to be challenging to get to the Largo Metro anyway. If you live in Kentland where I live, I would have to get on the Orange Line, take the Orange Line down to Stadium Armory, then come back up just to get to Largo Town Center. If you want to ride the bus, you have to catch 2 buses to get from where I live in Kentland, which is just a mile down the street. Now, we can say Largo's a wonderful site, which it is. The Metro is right there. You could do like you did at Hopkins. I had surgery at Hopkins. I appreciate the facility. However, if we don't make sure that the transportation issues are addressed with respect to public transportation in Prince George's County, it doesn't matter where you put this hospital center. If the people can't get to a bus to get to the Metro or even get to a Metro station, because the stations are spread out, it just doesn't make any sense. The other issue that is very concerning to me is that clearly this is going to be some sort of a trauma center. It has to be to accommodate the needs. If that's going to be the case, then I am concerned about how are you going to ensure that with the stadium being where it is, that that's going to be addressed, because whether you put it at Largo, whether you put it at any 4 of these locations, that's going to be an issue that's going to have to be addressed. Now, of course, everybody's home watching the game or at the game getting drunk, so it doesn't really matter. But the point is that needs to be addressed. What my thought on this is, why don't we do it this way? The areas that need most public access, the people who don't have cars, the people who aren't lucky enough like me to have an automobile, put those services near the Metro. If you have, thank you very much. If you have those services near the Metro, then that's fine. And have the more long-term care maybe at the second center at Landover Mall, because we need the economic development and we need the jobs in the Landover area. Thank you.
My name is John Leake. I'm a resident of Lake Arbor. I have been a resident of Prince George's County for over 40 years, member of the New Bridge Homeowners Association and the Lake Arbor Civic Association, and a member of St. Joseph's Catholic Church in Largo. I want to thank those who have been working to bring and increase the quality of health care to Prince George's County, and particularly to Central Prince George's County. So I thank you for doing that, because this is becoming a reality. I speak in behalf of the site being the Largo Town Center, and I strongly support everything that Chuck Redinger said. And in fact, I would encourage you to take, I'm sure he has it all written out, to take all of his notes that he gave you and let that be your way of addressing all of the criteria you spoke of, because he did an excellent job, as he always does. Once again, I encourage you to take what I believe is the best site, considering the criteria that you laid out to us. And thank you.
Good evening. My name is Cheryl Court. I'm with a nonprofit called Coalition for Smarter Growth, and we've been collaborating with a lot of terrific residents in Prince George's on this issue for a while in terms of looking at the opportunity of bringing such an important healthcare facility to a very accessible location that will both create access by bus and rail and also can jumpstart economic development for the county. We agree with the other speakers that the Largo Town Center Metro Station is a tremendous opportunity. I know there's some technical issues around that. I just want to suggest that the 20 acres of the Peter N.G. Schwartz site on the south is plenty of room for a fantastic hospital and associated medical office buildings. Expansion can happen in the future at the Boulevard site as you gain control of that. I know you're going to have a hard time getting the control that you need in a very short period of time. And so we don't want to miss the opportunity to really do everything that we can do with great health care and transit-oriented development by missing an opportunity to bring this great facility to the Largo Town Center Metro Station. I also want to say that there's an important workforce access argument for the Metro Station being regionally connected. Your healthcare business is an incredibly competitive one. There's a shortage of personnel at all levels, and we need to really be able to accommodate and attract the best in class personnel up and down from all the different positions, and that creating a mixed-use, walkable, transit-oriented place that's integrated into a larger context is going to have the most competitive offerings for the kind of workforce that we need to attract to this site. And I just wanted to note that I collaborated with a lot of other people to create case studies in design excellence for medical centers, and it's on our website at smartergrowth.net, and it's a great opportunity to sort of inspire us to look at the kinds of quality healthcare facilities that really connect with their communities and take advantage of major infrastructure like a great roadway network and also the metro station. Thank you.
Hello, everyone. My name is Denise Douglas. I've lived in the Prince George's County area since '84. And I am so proud to be a citizen of the county because ever since I've been here, it's been growing, growing, growing. And to hear about the new medical center, I am very happy that it will increase our economic base tremendously. So I'm very proud of that, and we will be leaders in the nation for that. What I'd like to know and be certain of is that the county can guarantee us, can tell us with absolute honesty and efforts that this will work. When we look at the Landover Center, when we look at the Largo Town Center, and we look at some other projects that have gone on through the county and how it has started tremendously and then kind of slowed down. And I like to know without a doubt that this will go on. It will be successful from the beginning to the end. That's what I would like to know. Location, location, location. We know that in real estate, location matters. With respect to the locations that we're talking about, my concern with Largo Town Center is congestion. I'm not sure. There may be some ways in which we could rectify that, but it's already congested. When I look at the Landover area, it's wide open space, and there's a lot that we can do with it, transportation-wise, getting people there. Maybe we could create another metro stop. I don't know, but whatever it takes to make it successful, I think we need to put the money there. Talking about economics, it's not just cost, it's what we're going to get out of it. And this is the opportunity where we can get the most bang for our bucks. So put the money there, we'll get 100, 1,000% return, not just with money, but with health care and with jobs and the like. And that's my say. Thank you.
Good evening. My name is Raul Dennis. I'm Prince George's Suite Media. I don't really have so much of a comment about where the facility should be. My interest is really in the possibility of emergency routes and preparation for it. And since there's so much coordination and cooperation amongst so many of our leadership, I see an opportunity here for perhaps an innovative approach to developing emergency routes along the 4 or 3 most trafficked areas to create an opportunity so that emergency vehicles and emergency personnel will be able to move more quickly. Now, on the first side of this, obviously, it winds up being a little painstaking for motorists because things have to be built. But at the long run, people's lives will be saved by the difference in the time that it takes for them to get to the facility. Further, in the long run, I think the facility becomes more attractive because it then becomes a national model for that kind of cooperation and building those kinds of routes that were anticipated and then expanded so that emergency services and other services, other vehicles could cooperate in a more efficient manner. Lastly, I'm thinking that I'm not sure if this is part of the plan, but if not, I'm sure a helipad or a heliport might be part of. Okay, so that's there. But I just wanted to add to the conversation there. Thanks.